Welcome, everyone. I'm Christy Lacey. Today we will be discussing how to request regional center services. This is part of a 4-part series that we are doing around the regional center. Our next meeting will be on December 4th at 12 p.m. We will be discussing generic services, things like Medi-Cal, IHSS, SSI, and CalFresh. If you want to know what those things are and how to get connected with them, please join us then. Also, all of our previous presentations have been recorded, so you can look those up on our website. We've been discussing how to apply for regional center itself, common regional center services, and today we will be talking about how to request regional center services. As I said, we are part of the Family Focus Resource Center. We are one of 45 resource centers and 36 family empowerment centers across California. We span across all the Northeast and Northwest districts, Santa Clarita and Antelope Valley. We have 4 offices. We have one in Northridge that's located at CSUN. We also have one at the Regional Center in Chatsworth, Santa Clarita, and the Antelope Valley. One of the great things about the Family Focus Resource Center is that everyone who works at Family Focus Resource Center, including myself, is a parent of a child with an IEP or a disability. These are our links. Our links have tons of wonderful resources, all of our workshops. A lot of our workshops are up on our YouTube page so that we can share all of that information with all of you wonderful families and caretakers. So I've mentioned the regional center a few times. I'll briefly go over it. California has 21 regional centers across the state. They provide a wide range of services to people with developmental disabilities. The goal of the regional center is to keep individuals living with their families and in their communities. We represent the North LA County Regional Center, we work with the North LA County Regional Center, the consumers of the North LA County Regional Center. North LA County serves San Fernando Valley, Santa Clarita, and Antelope Valley. And there are a few different areas of the North LA County Regional Center, beginning with the Early Start, which serves consumers ages 0 to 3. Provisional, which is a little bit newer, which serves ages 3 and 4 to those consumers who may not meet all of the requirements to move on. School age, which are ages 3 to 13. The transition ages of 14 to 21, and adult, which is 22 and up. So today we are talking once again about requesting regional center services. So these are 5 helpful steps in requesting regional center services, and we're going to be going in depth on all of these today. The first is to identify the need and what the goal for the service is. 2 is to figure out who serves that need. Some examples we'll look at are insurance, the school district, generic resources, or the regional center. 3 is to find a service or vendor that fits the need. The more info, the better. This is not required, but is very helpful if you are looking to expedite the process. Number 4 is to call your CSC and request a meeting to amend the IPP. And we'll talk about what that all is. And 5 is to present the need, the goal, and then the service. Step 1, identifying needs. So here I put up a little bit of information about the Lanterman Act, and the Lanterman Act was passed for California into California state law in 1969. This is a significant state law that outlines the rights and responsibilities of person with developmental disabilities, and it also created the regional center as a central point of contact for persons with developmental disabilities. The act itself makes the framework of the services that you're asking for and how to ask for them. So the Lanterman Act establishes an entitlement to services and support for persons with developmental disabilities. This entitlement means that individuals with developmental disabilities have the right to receive services and support which enable them to make decisions and choices about how and with whom they want to live their lives, achieve the highest self-sufficiency possible, and lead productive and independent, satisfying lives. The Act charges Regional Center with advocacy for and protection of those rights, and the federal government states that services under the Lanterman Act must reflect the unique needs of the individual and reflect what is important both to and for the consumer. So really why I shared all of that with you is to share that the Lanterman Act is in charge of sort of setting the guidelines of what qualifies the need for a service. And there are three main priorities are: one, safety. What services do you need to keep you safe? So as you think about requesting a service, see if that is something that fits in. Is it something that is helping to keep the consumer safe? Two, community access. What services will assist you to get out and about, to get to know community members and to participate in your local community? And number three is remaining at home. What services will allow you to stay in your preferred living situation? For children, there's a high priority to provide services that keep them living with their own families. When you're requesting regional center services, it's important to remember that everything kind of goes backwards. So needs drive services. So you cannot just request, generally, I mean, you can do whatever you want. It is best, or the way that it works in your IPP plan, is that instead of just saying, I would like social skills group, each service must fulfill a need in the household and have measurable goals tied to it. So you always start with the need first, the goal for that need, and then it moves on to the service that fulfills that need. Let's take a look. So here I have an example of social skills. Say you found a social skills group that you think would be great for your child. The way that you would go about it is not saying, I would like to sign them up for social skills, because then they're going to ask you all of the questions to identify the need. The best way to do it is to come with the need first. So for social skills, Bobby loves to be around people, but doesn't know how to approach other kids or start a conversation, which is important to the consumer. Bobby needs controlled environments as well as scripts and coaching on how to navigate those interactions and more opportunities to practice. That's what's important for the consumer. The goal for Bobby is to gain the tools and competence for making friends and interacting at an age-appropriate level. That's the consumer's goals. I think Bobby would benefit from the tools learned and the consistent practice of a weekly social skills group. This would give him the ability and confidence to approach his peers. This is how the service serves the consumer's goals. So always try to, if you find the service first, you're going to build your way backwards to see what need is being met by that service. There cannot be a service without a need present. Here I have a couple of links for you, and these really are lists from North Lake County Regional Center about the services that they provide. One of the reasons that I wanted to bring these up is because, one, if you click on these links, it's going to let you know if your consumer fits the age range that is served by that service. So for adaptive skills training, if you're an early start, there's going to be a different program for that. You might look at floor time or something else. For 3 and up, you would look at these other services. And here it also gives a specific description of the needs that are met by the service. So if you were looking at an adaptive skills training place, you could go in here and say, okay, what are some of the things on here that are a need that we have in our household? Do I need training on how to reinforce the child's learning skill? Does my child need help with learning chores or crossing the street safely? Do they need help with making decisions? And there's a full list of all services, the ages that they serve, and then the exact wording of the service that they provide or the need that they cover. So you can go through this list. This list will be in the links in the slides that we send you after this meeting. So you can take your time to go through and see what is a good fit. So once again, remember that needs drive services. What are the needs of the consumer? So when you're thinking about needs, a couple of straightforward questions you can use while crafting what the need is are: what needs in my household are being unmet? What does it look like day to day? What services do we currently have that are maybe not working, and what are the reasons that they are not working? What are some of the goals that we have for our child that are currently unsupported? What areas of life are unsupported? Maybe you have something to provide social skills, but you don't have something to provide safety. And what services and are the services and goals person-centered? We'll talk a little bit about more about person-centered planning later, but remember, we always want to ask what is important to and important for the consumer. So these are just some prompts to help you to kind of find ways to talk about the need and what it looks like in your households. Step 2, what we look at is who serves the need. So regional center does not cover every need. There are certain agencies that cover different areas of need. So we're going to look today and learn a little bit more about who serves what need. One is your insurance or Medi-Cal. Number 2 is the school district or your IEP. Number 3 are generic services, which we'll talk about briefly today. And then 4, of course, is the regional center. Note that the regional center is a payer of last resort, meaning that if a need is established and no other program will fund it, the regional center then becomes the one to serve that need. Also, all other sources must be exhausted before regional center becomes responsible. So briefly, we'll talk about payer of last resort. Here are some of the reasons that regional center may step in as the payer of last resort. 1, there is no natural or appropriate support, no naturally occurring support such as parents or teachers to fill in that space. There is no generic resource, meaning no city, county, or community program to meet the need. That there's a gap in services from another source. So you're waiting to begin a service and that won't be starting through your insurance for a few months because there's no opening or there's a wait list, but there's an immediate need, or the other source does not provide enough help. So one good example is that Medi-Cal covers a dentist, but that dental won't cover anesthesia, and your child cannot do dental services without the anesthesia due to sensory issues. You could seek out regional center as a payer of last resort. So let's talk about who serves what needs. So insurance and Medi-Cal, they serve any medical, physical, psychiatric needs, anything given by a licensed medical professional, such as a dietitian, speech, occupational therapy, ABA. Many regional consumers are eligible for Medi-Cal regardless of the parent's income through institutional deeming with a Medi-Cal waiver program. So that's something to keep in mind as well. If there is a medical provider that has a large copay or that you're not able to access through private insurance, even if you make above that threshold, you can reach out to your service coordinator and ask them about the Medi-Cal institutional deeming waiver. When transitioning from early start, many of these services will move from the responsibility of regional center to your insurance or Medi-Cal. We find with a lot of our clients that that's a sticky point, is that When moving from early start to traditional Lanterman services or school age services, all of a sudden there's this big transition where regional center used to cover everything as part of their early start program. And now it's being pieced out to either the schools or to your private insurance. So these things can still be covered, but now they are moved to your insurance or Medi-Cal coverage. Another area of need that is served is through the school district or the IEP. School or IEP serves all needs that happen within the school day, or what is also referred to as bell to bell, or needs associated with academics. Some examples are school-based speech, school-based OT, school-based occupational therapy clinic, one-to-one aids, or transportation to and from school. Another source is generic services. Generic services are any program that can meet the general need of a regional center consumer. They may include, there's many, but they may include CalFresh, Medi-Cal, the Access Ride program, or IHSS. These can also be nonprofit or local programs that serve the distinct needs of the consumer. And of course, there is regional center. Regional center is tasked with serving the developmental needs, inclusion needs, and equity needs. The regional center provides services that empower people with disabilities to have opportunities to achieve their fullest potential in all aspects of life, as we remember from the Lanterman Act. These include social skills group, adaptive skills training, respite care, in-home daycare, some paid internship programs, social recreation, and summer camp. There's a large list depending on what the needs of the consumer are. Step 3 is to find a service or vendor. Again, this is not mandatory. Your service coordinator, once you present a need, can suggest who serves it or where it could come from, but it's always great for us to be empowered and to be able to know where to look to find the answers as well. So here are some places where you can find services. Of course, the Family Focus Resource Center. We have a large library of vendor support services, anything you can think of. You are always welcome to contact the Family Focus Resource Center, let them know what you're looking for, and we can send you something from our library. Also support groups. We also offer support groups. There are support groups out in the community. It's a great way to hear of how other people are solving problems or getting needs met, or to ask questions and hear from other either professionals or other parents. Other parents are always a great resource, reaching out at the school level in any groups that you are in and hearing what other parents are doing to get needs met. You can, of course, do an online search if you love to research. You can ask any therapist that you're working for. If you have a therapist that you really like, they might know other like-minded therapists or know parents that are going to different play groups or social groups or whatever it is that you are looking for. Disability fairs. We recently had a very large disability fair that was going on, our All Abilities Fair, where many, many vendors get together and you can walk through and get pamphlets and see what is out in the community. So you can look that up in your area, find out what's going on. And as I said, your regional service coordinator, you can ask them for suggestions. You can ask them if they know of any vendors that fit the bill. A little information about regional center services. So again, we have these lists that I gave you before. The first one right here is the one we already looked at. We'll look at a few other things. just so you can go into it. This is a real deep dive into the services, exactly what they are by age. So again, if you're a big researcher, you can learn more about the Lanterman Act, more about regional center services, more about person-centered plans. This is a really big, meaty document if it's something that you want to really dive into. There's information about school-age services, IEPs, all of that is available here. Again, so that you can kind of know who serves what purpose, what is available out there. So often a lot of the biggest barriers between, us and getting the needs met is simply that we don't know what even exists. So we don't know what to ask for. So this link will be in the document as well. Under service standards, we have another large document that this one really gets into either for early start, the IFSP or the IPP development. So this is going to talk really about the IPP, and it also gives a breakdown of all of the family support services, all of the social recreation. So again, you can get into the definitions and what is served by all of these different services. Step 4 is going to be to meet with your consumer service coordinator. And the steps to doing so are: call and email, say that you have identified new needs and would like to discuss the current IPP. We know that there are some wait times right now. Our suggestion is to try about 3 times connecting, giving a few days between each attempt. The next step would be, if you're unable to contact, to call and ask for the supervisor or the officer of the day. So if you call Regional Center and ask for the officer of the day, let them know you're trying to get in touch with your service coordinator. They should be able to put through another message. And then the final step that's available is to contact coordinated family supports line. That would be someone who can work one-on-one to try to get you connected. Here's some information about the family support specialist. If you need help navigating the system, if you need to be connected and you're unable to do so, this information will be shared with you also. Coordinated Family Supports is another program that is for individuals over the age of 18 living with their families. They give help with the transition to adulthood, coordinating different support systems. This is a new service from the Department of Developmental Services. So if you have a consumer who is moving into that age of 18 and moving into more adult services, this is a great resource for you to be able to connect and to learn about the new things that are available for you, the new services. And step 5, once you meet, you are going to present the needs, goals, and the service requests. So when you meet with your service coordinator, what you're going over is called an IPP, which stands for Individual Program Plan. Every regional center consumer has an IPP that is written out, and it's basically this document that you create with your planning team that shows all of the services that you are getting, the needs and the wants of the consumer. So here it says the IPP is a written document that you create with the planning team. This document should be person-centered and has information about you, the consumer. It includes what is happening in your life, what is important to you, and the list of all of your goals and future plans. The IPP will include a list of services and supports that you and your planning team agree will help you meet those goals. So again, a need, a goal, and then the services that will help you meet them. IPP meetings can happen as often as you need or as goals change. So you will have one every year, but you can call one whenever necessary. Your service coordinator will monitor this plan regularly. You may call together your planning team at any time by contacting your service coordinator. I'll click on this link. We'll see it again in a moment, but if you're interested about the IPP, exactly what it is, getting, there's links here to a workbook of how to put together an IPP if you're doing it for the first time, or if your yearly IPP is coming up. That is something that is really useful. It's going to break it down. It's going to have you fill out all of the information that you will need to have a successful IPP meeting, provided by the Department of Developmental Services. On January 1st of 2025, I'm sorry, of 2024, the regional center started using a new documentation for the IPP meeting that is based in person-centered planning method, but until 2027, it must be requested. So if you would like to use the new model, which asks what is important to, what is important for the consumer, and focuses really on the unique needs of the consumer, that is something that can be requested prior to the IPP meeting. The person-centered planning model allows the IPP to focus not only on the unique needs of the consumer, but also to focus on the unique wants and interests of the consumer as well. So here, once again, it takes us to this page. You can click here where it says the IPP template, and you can see the new IPP plan and template and procedure. So this is actually what your service coordinator is going to be using in order to decide what services are appropriate and what needs there are. So you can look all of those up and see how to plan with all of that information. There you go. And this here is the new person-centered plan, which you can click on and download and fill out. So person-centered planning questions: what is important to and what is important for the consumer? What unmet needs look like? How do they manifest? What does the consumer like or dislike? What makes a good day for them? What makes a bad day for them? What are the consumer's short-term goals? What are the consumer's long-term goals? And again, we have that link to the plan template. What I will say is that this, you don't have to go this in depth every time you ask for something, but this is a great way to plan for either your first or a yearly, or if you're not getting any services currently and you want to do kind of a full plan, a deep dive to get all of the needs met at once, this would be the type of planning that would be helpful to do beforehand. And just to look a little bit into what that document actually looks like. It asks a couple of questions, things, what people like and admire about me, what I want others to know, my successes, how much they want to participate in making their plan, long and short-term visions. So that would be like short-term goals, long-term dreams. It asks about how they communicate, how they like to make decisions. Again, what's important to and what's important for and what's currently happening. This would be where you would discuss the need. It even makes a place for emergency planning. And then there's multiple places where you can put more and more, fill one out for each need that is coming up. So it's a great new tool that's available. What are the consumer's long-term dreams? Dream big. So when you talk about the dreams, it should be exactly what you want or what the consumer wants. Two things I wanted to talk about. A lot of times what parents are requesting recently are social recreation programs. So that would be like those summer camp programs, spring and winter camp, or after school activities such as martial arts, swimming lessons, those types of services. There is a new FMS system that has been put into place. So I just wanted to mention that briefly. When you are requesting a social recreation service, there are two requests that you are able to make, or two ways of having that fulfilled. One is through parent reimbursement. So this is the traditional way that has been going on the longest, where you would pay for that after school activity, you would submit the receipt and be reimbursed. There's now the financial management system, which allows an FMS company, you would agree upon the service beforehand. So say swimming lessons are $100 a month. That would be agreed upon beforehand. And then that check would actually be cut from a financial management service company that they are now getting reimbursed from North LA County. So the parents no longer have to pay out of pocket beforehand. But just remember that these need to be approved and set up before beginning the classes. You cannot get back pay through FMS. Back pay always has to be through parent reimbursement. So just some information for you to have and something to remember to mention if you are looking for that summer camp social recreation service. So once again, just to go over what we talked about in the beginning, remember that needs drive services. There are no services without a need being present. What are the needs to the consumer? We already went over some casual ways to think and look about taking your notes. What needs are being unmet? What does it look like day to day? What services are not working? What goals are unsupported? What areas of life are unsupported? And are services and goals person-centered? Again, if you need any help with any of the information that we talked about today or would like more information on any of the subjects that we've discussed throughout our series or today, and you live in the North LA County Regional Center area, we would love to help you. We are the Community Navigator program within the Family Focus Resource Center. We do a lot of application assistance for either regional center services, generic services, helping you get in touch with regional center. So this is our information. Please feel free to reach out to us. We love to help one-on-one. And again, we have one more live series of the Community Navigator series that is coming up, talking about generic resources on December 4th at noon, Wednesday, December 4th at noon. All of our prior subject matter, again, is available online for you to go over and to catch up on. Once again, our links that can give you connections to those support groups that we talked about before, all of our backlog of information and wonderful speakers and webinars at our YouTube channel. It's a great resource. And I just want to say thank you for everybody for being here today. I hope you found this information helpful, and I hope you have a wonderful rest of your day. If you don't mind looking in the chat, we have the survey available there. If you could take a moment to quickly fill out the survey, we would really appreciate it.